Firstly, can I say it's fabulous seeing so many people here this morning. Thank you all so much for coming, because it's down to people like yourselves that our network is the success it is. It's my pleasure to start off just by giving a little bit of an explanation about the maternity network in South West London and why, in fact, we're all here. The way the network operates has evolved since its inception in 2013, and it will continue to have to evolve. The big thing we're all waiting for at the moment is the London Health Commission report. That's Boris's London Health Commission, and that's due to report in December, I understand, and that will have an impact on maternity services as well as the rest of the health services in London, and it may well impact in South West London too. So, clinical networks. This is a concept that is very much supported by NHS England, and I think there was some very successful work in previous years around networks for cancer care, for stroke and perinatal networks, and they want to build on that. And the maternity network, if you like, has taken on that role. What I did want to do was just give you a bit of a context about what's happening across London, because I don't think South West London can ignore that. We still have 25 trusts providing maternity care on 33 sites. This slide's actually wrong because it says 2 standalone birth centres, and I'm aware of 3. So it shows you how fast the climate's moving in London. We have 132,000 births approximately in London, and approximately 19 to 21,000 of those happen in South West London units. We have issues with stillbirth in London. We have issues with maternal mortality in London. There are a number of levels of clinical network. Now, the South West London networks actually existed before 2013, but in its current form, formally was set up on the 1st of April 2013. It was like-minded clinicians, midwives, obstetricians, public health, neonatology, anaesthetics, all wanting to come together to make things better for women using maternity services, both in terms of safety and quality and their experience. And one of the starting points for the network in South West London was the premise that we can't do anything for women unless women are with us and telling us what it is they need and want. So we've had a drive, and we will continue to have a drive, to have women themselves working with the clinicians to help us improve services. Please forgive this chart. It is not mine. This is a diagrammatic representation of what is known as the Pan-London Strategic Clinical Network. Very complex. All I want to do is illustrate that in October of last year, a strategic maternity network was set up. And that contains clinicians from all over London, as well as service users and other key organisations and parties involved in maternity. And they very much take a pan-London view. So on initiatives like trying to reduce stillbirth rates across London, or trying to reduce maternal morbidity across London, they will take a view and they will issue guidance that they are hoping the other local networks will pick up and take forward. So there are national priorities in England. One of the issues is about consistency of data collection, and I'll come on to that very briefly in terms of South West London. There's a big drive to improve preconceptual health, because I think we tend to think of that for some reason as an afterthought, and it's certainly something in our network we haven't yet touched on, and it may be something we need to go back and look at. We want to reduce stillbirth. We want to try and lower the preterm delivery rate and to reduce maternal obstetric hemorrhage. One of the challenges for us as a local network, working with the strategic network, is to avoid duplication of effort. So some of these initiatives we'd actually kicked off before the strategic clinical network came into place, and we've then said, okay, we'll stand back from that until something comes out from the centre, and then we'll revisit it. So postpartum hemorrhage, for example. And there's just been a Pan-London toolkit issued to help reduce postpartum hemorrhage. And we will be looking at that at the network board next week with a view to what can we do in South West London that fits in with that. So networks are a bit patchy. Certainly in terms of maternity networks, the first kind of local one in London was in North Central London. And then a network was set up in North West London. And very sensibly, North West took the work from North Central and just tweaked it for local use. And I have no hesitation in saying that when we decided to get together in South West London, that's what we did. Went and talked to the people in North West and North Central and said, thank you very much, we'll take all that stuff that you've had all the hard work on and we'll build on it locally. The whole point about networks is to learn from each other, not to start reinventing wheels all the time. Learn the good bits, learn from people's mistakes, and try and move on. So in April, we decided that what we wanted to do was have a collaborative approach, and I think it is to the credit of the clinicians in the provider units in South West London that actually they had that ethos about wanting to work collaboratively. Now that makes it sound really easy, and it's not. As we all know, I can see Polly shaking her head, but there are real challenges to that about getting everybody on board. But the starting point is to want to do it. And the other bit that goes with that is there are some aspects of the maternity services that if we worked more closely together, there might be even greater benefits for women and for midwives and obstetricians and use of staff. So in the early days, one of the areas that was flagged up was things like home births. Can we improve the home birth rate? Midwifery-led units. Can we make better use of midwifery-led units? We had to get the boring bits sorted out, so we had to sort out the kind of governance-y stuff about what our aims were. What was the terms of reference? What were the kind of things we would do and what wouldn't we do? How will we organise ourselves? And we've had a couple of iterations since the beginning about how that structure operates. Who will be members? Now, the South West London network has a very open view to membership. So although it started from maternity provider units, very quickly general practitioners, commissioners, women's representatives, public health, perinatal mental health, neonatology were all invited to the Kirk, if you like, and joined in. And then the next thing was to agree a work plan. And certainly in the first year, we left it to the broader membership to say what their views on priorities were, but we ended up with a portfolio that was like just too big to contemplate. In the second year, the board took a much more strategic view around these are the key priorities we want you to focus on this year, with a view to just keeping the momentum going and building on the enthusiasm. So why are we here? Why are we all bothering about this? Well, there's no point in having a maternity network that isn't focused on the needs and wants of women and their families. That's why we're all here as clinicians. And what we want to do is not just ensure safety, we want to have the highest quality maternity services in the country. So we're starting high. We want to improve access. You know, it's all very well having high quality services, but if women can't access them, can't get into them, can't make use of them easily, if there's a large population of women who may not originally be from London, who don't know how to get into the system, then there's issues for us in terms of access. We wanted to get into a position of clinicians who are experts in maternity, along with women using services, advising the commissioners of the services. So we are the experts in this room, and it's down to us to say this is what high quality maternity service looks like. I've talked about maximising opportunities, about being efficient and effective, and that's about learning from each unit about, oh well, Kingston has a higher midwifery-led proportion than the other units. How did they manage to do that? Croydon has a higher spontaneous vaginal birth rate than the other units. How did they manage to do that? Now, I'm sure all of you have had your mandatory training in the units for the past year. What's stopping us sharing that mandatory training and going from unit to unit, rather than actually insisting that our staff have their own one, and if they move to a new unit, they have to start all over again? So there's issues about efficiency and effectiveness there. As you can see, in South West London, we are slightly simpler than at the strategic level. We have a network board, and on that board are all your directors and heads of midwifery, all your lead obstetricians for the labour ward. There's a consultant anaesthetist, there's a neonatal network links, perinatal network links, as well as a number of women. And we want to increase the number of women on the board. There are two working groups. One is improving outcomes, and one is models of care. Now, I always find it easier to talk about the models of care one, about how can we improve things like continuity of care, how can we improve home birth, And the second group, improving outcomes, tends to look at the kind of clinical outcome stuff. And it would be looking at things like, can we improve recovery from caesarean sections so women can go home earlier? Can we improve postnatal care in the hospital? Can we reduce unnecessary interventions? We have a kind of reporting line, a dotted line, because actually we don't report to the Strategic Clinical Network, but we do advise them and communicate with them. And we also communicate with the South West London Commissioning Group. So the 6 CCGs in South West London have all come together into one collaborative body. And we have one person who's responsible for maternity, and that's Paula Swan, who is from the Croydon CCG, and I work very closely with Paula. The person that we couldn't live without, who is our network coordinator, who's Kate, who I'm sure most of you have had email dialogue with, and she's the hub of the network. Without Kate's organisational skills, we would all just fall in a heap, me especially. So what have we done in the first year? We've created the South West London Maternity Dashboard. And for those of you who were involved in that discussion, I'm sure you'll agree it was challenging at times. And a number of us had to compromise and had to say, okay, I'm not 100% happy with that, but we'll go with it and see how it goes. I'm going to concentrate on the dashboard at a later session, but it's a big spreadsheet that looks a bit like this. And it compares data and outcomes from all the units to agreed definitions, so that we can actually, for the first time, compare like for like. So we can compare things like normal birth rates. We can compare things like caesarean section rates. The Enhanced Recovery Programme, Polly's going to be talking about, so I won't go into that in great depths, but great stuff. One of the London initiatives that we were asked to take up was outpatient induction of labour. And this was a move to try and manage some of the capacity issues in some of the units across London. Now, although it's very busy here in South West London, in most of our units we actually have a bit of capacity, so we could take a few more women up and down. In some of the North West London hospitals, they have no capacity at all. And this is one way to help manage by low-risk women, if they want an induction, having it as an outpatient. There was a full review of maternity support workers, which was work led by Georgina on behalf of the network, and that was to look at who was using support workers, what was the scope of their roles, you know, what salary bandings and things they were on. And that's the first step to work that's being done in the Models of Care group to look at how can we best use support workers consistently across South West London. Can I ask, have any of you seen the South West London information leaflet for women asking for caesarean section? This is an information leaflet that has been agreed across all the maternity units in South West London, and it's specifically aimed at women who are asking for caesarean section without a medical indication, so that all the units are saying, using the same information for consistency. That doesn't mean to say individual units might not handle women, handle's the wrong word, but they might not manage women in a different way, but at least the information women are starting with is consistent across all units. And the other achievement, which has gone live now, is the South West London Network website. And you're going to be sick looking, you won't be, you'll be enthused this morning, looking at the website details, because this website's for you. It's for people to use, interact, find information, start a conversation about, you know, I'm really worried about episiotomy rates. I am really worried about episiotomy rates. Start a conversation and get your clinical colleagues from all the units to join in and to learn from each other. So what are the challenges? Well, one of the big challenges is about maintaining consistency of membership. So when we started off, we had all sorts of people nominated or nominating themselves to join the network, and probably about 30% of those actually made it to a meeting. And for a variety of reasons, you know, we move around in London, people leave jobs constantly, and trying to keep up with that kind of churn of staff, particularly on the midwifery side, has been a bit of a challenge. Similarly with our medical colleagues, they have had their work plans adjusted, so someone who might have had a bit of time to come to the network suddenly finds they've been given another job and can't do it, so there's change over there. We did have an issue with some poor and inconsistent attendance at meetings. Now for the board, that has settled down. It's very much consistent membership and attendance, which makes a huge difference to knowing where the thinking's going. But for some of the working groups, that's still an issue. And one of the things we would really appreciate from you today is some thoughts about how could we get that better. Ongoing issue that I certainly, and I know my colleagues on the board worry about, is the gaps between working group views. So the way we normally approach life is to get someone to volunteer to lead a piece of work, go away with a group from various units, start producing that, discuss it with all their colleagues back at the units, come back, redraft it, take it back to make sure everyone's happy and come back. Now there's a gap there. Sometimes we get to the stage of the board signing stuff off and we realise not everybody is happy because they haven't seen it before. So we have to work through how we can get that better. One of the challenges is about getting units to measure things in the same way, and I'm sure St George's will forgive me for using them as an example. This is the group defined how they were going to measure vaginal birth after caesarean section. And as you can see on slide, I'm going to come over here. As you can see on slide 1, St George's is way down here. Well, all that is they weren't measuring it in the same way. What St George's were doing was actually measuring it the way that they were asked to do, which was about the proportion of women who could have a vaginal birth after caesarean and who actually achieved it. Whereas the other units were measuring the women who had a vaginal birth, who attempted a vaginal birth, who were successful. And that's not the same figure, yeah? So we've had some ongoing work on a variety of the categories on the dashboard to get those issues sorted out. This website has a public face, which contains information for the general public about what our activities are and all sorts of things, and links to other helpful information sources. But it's very much on the professional side, or a network membership side, a portal that people can access information, hold conversations and do virtual working together. So the members only side, for example, if you contact Kate, she will give you a personal login that you can then use, and you can access information and join in the discussions on the website. 2014, as you can see, we've got lots of work on the way. Some of this is a further stage than others, but it's all happening at the present time, and we need your help to help move it forward. So I'm going to ask you today, not to tell me right this minute, but we need working group members. We are setting up what's called a virtual group, and that's for any obstetrician, anaesthetist, midwife, women using maternity services to join in. And when we actually get to the stage of a piece of work has been drafted, we will send it out to the virtual group and ask for their feedback. And it's one of our ways to try and access more of the clinical staff, certainly, about what things look like. You can feedback on the website, you can contribute to the thinking on the website, and you can join the debates. And some of you will hold useful pieces of information that the rest of us aren't aware about. And if you think it's useful and it's going to have an impact on thinking, then if you let Kate have it, we'll put it on the website. Easy as that, we can share it. So I'm going to stop there. So I'd like to thank you. And you'll notice the website address on the bottom. You will see that lots of times today. Thank you very much. Thank you.